This is going to be a quick video about how to taper your patients off of opioids. Opioid withdrawal is not something that is life-threatening like a benzo withdrawal or an alcohol withdrawal is, but it's still really important because your patients can get extremely uncomfortable with this and it could ruin your relationship with the patient or their attempt at trying to wean off opioids. So there's a couple different ways that you can taper off of opioids. Slowest would be preferable, though sometimes, depending on the circumstance, that's not always realistic. So we'll go through a couple ways and how to taper them. So, like I said, slow taper is best. This would be 10% of taper of MMEs every 1 to 2 weeks. And you would do this, obviously, if your patient is not getting benefit from opioids, that would be an instance that you would want to take them off of it. Sometimes patients have benefit at first, and then they have to continue to increase the dose, and they get to a plateau where it just doesn't help them anymore. This is often known as hyperalgesia, and that is just when your pain actually gets worse from being on opioids. So you can think of it as kind of like an increased pain rebound response. So that is another instance that it would be best to take your patient off of opioids and try something else. If they're having side effects, specifically non-urgent side effects such as constipation or nausea or something like that, you would want to wean them down slowly and also try a different medication, or if they're not compliant. So if they're not taking it at all, or if they're taking it differently than you describe, they might not be a good candidate for opioids and you would just want to wean them off. So there are some instances where you may need to taper them off quicker. That would be if they violate your pain agreement. So most providers who prescribe opioids, they make a pain agreement with their patients and they both sign it. And it basically says if you don't follow what is agreed upon between the provider and the patient, that they will taper you off. And so if they violate this, a good reason to take them off. If there's high risk for opioid use disorder or you think someone has opioid use disorder, you definitely want to get them help and do not continue their opioids. So that would be a reason to rapidly taper them off, to try to get them help and try to fix that as fast as possible. Another reason to rapidly taper someone off of opioids would be if they have a positive urine drug screen for something other than opioids. So if it comes back positive for meth or heroin or what have you, any other drug substance that could be interacting with your opioids or also at potential for abuse, that would be a red flag and someone that you would want to taper off. Now, if you're trying to do it quicker, you can do it every 3 to 5 days, decrease 25%. This is also often done in the hospital just because they're being monitored a bit closer in the hospital. So you can do a quicker taper and just monitor for any symptoms. There are a couple situations where you just want to stop opioids completely. That would be if someone overdoses. So if they're hospitalized for opioids, do not restart them. If you think one of your patients are diverting their opioids, so that means they say that they're taking their pills every day and you get a urine drug screen and it's negative, that means those pills are probably going somewhere else. So they're probably selling them, giving them to family or friends. That would be a reason to stop them immediately. And then this isn't as big of a problem with the electronic medical record, but of course, if there's any forgery of prescriptions, that would be a big reason to stop opioids with your patient. And then if your patient makes any threats to you, to staff, to themselves about basically trying to take control of the situation with their opioids, absolute contraindication to having them on the medications. And then if your patient is suicidal, so opioids often, unfortunately, are used for accidental and purposeful death. And so if your patient has suicidal history or current suicidal ideation, definitely with any suicide attempts, you would just want to stop them completely. Like I said, stopping opioids is not a life-threatening condition. It's just going to make your patient extremely uncomfortable. They'll likely have GI upset, diarrhea. They can be anxious and just very uncomfortable. And so if this is the scenario, like I said, don't give them a taper. Just stop it directly. But make sure you get a stat referral to addiction medication clinic, because if some of these are happening, overdose, diversion, threat, suicide, anything like that, they need more professional help by someone who is used to dealing with patients who have opioid use disorder, and they can watch them a lot more closely. So that is just a quick overview of how to taper your opioids, and something to always pay attention to if you have a patient who's past the acute phase after surgery, or just doesn't seem like it's working for them anymore. Make sure you always have in the back of your head, might be a good idea to taper them down and switch to a different medication. So I hope you learned something from this lecture, and good luck.